The biggest beauty of seeing the patient, finishing the note when the patient is still inside the room, is that we actually know how much to collect at discharge. So we actually collect the patient's responsibility at discharge. The Aprima system gives you the number of dollars for the person who is checking them out. So I like to free type all of my histories. My examination is you click on one thing and gives a standard follow-up exam, and then I just have to modify the changes why they're not normal. If I have a patient with MS who has lots of a lot of abnormal findings, I would start with their last exam, and that's automated also. And then the assessment, I'm sure like most physicians, most of my patients fall into a few specific groups. So for new patients, I have a lot of a pick list of different things like for chronic migraine or cluster, episodic cluster, or someone wanting to get pregnant. That fills in a lot of boilerplate language, and then I just modify what I'm going to start that patient on. And the RX writing script system works extremely well. And then, and so my notes are done before the patient leaves the room. If we do a procedure on them, all that is documented also before the patient is done. And that's how the front desk knows exactly how much money they owe us. With the allowed schedules that are set up in your system, the system can tell the person who checked it exactly how much money to collect. And so that runs things very smoothly. And then the biggest improvement over the last few years is the expansion of the patient portal. I probably do about an hour a day of admin time and 7 hours a day of actually seeing patients. And that ratio compared to some of my peers talking at meetings seems to be much better than most people are talking about. My favorite feature in Aprima, from a practice standpoint, is being able to collect the money, knowing that their insurance is valid, all in an automated fashion. From my side, it's being able to use the portal. So I can answer questions via the portal much faster than I could taking phone calls. Really have enjoyed the system. It's been a big help for us.